Dr. Utsav SHAH. Is he here? Yeah. So he'll be presenting on Fundus biomarker of retinopathy of prematurity.
Good afternoon, everyone. I'll be talking on Fundus biomarker of retinopathy of prematurity, and I have no financial interest to disclose. So, as you all know, the knowledge on ROP has been based on examining the eyes of baby at risk at certain point of time. And in the recent year, there has been tremendous changes in the profile and pattern of ROP within various part of the world. So, in this prospective study, we wanted to explore the story of how and when an eye with no disease at birth develops retinopathy by serial fundus imaging. So this was a study which was conducted at LV Prasad Eye Institute, Bhubaneswar, which is linked to 35 NICUs in 15 districts from 1st of April 2022 to 31st of March. So the process in brief, so we identified all the babies at risk of ROP, and after proper parental consent and counseling, we take a retinal imaging with the help of 3 Netra Neo. The first examination was done within 1 week of the birth, and thereafter every weekly till the development of ROP or zone 2 mature retina. However, few babies were excluded, such as babies which are too unstable to image, eyes with media too hazy to image, inadequate follow-up, and lack of parental consent for the study. So all these images was analyzed serially together with a goal to get an insight into the chronology of event from no disease to ROP, to find any fundus biomarker, if any, for predicting of any retinopathy, to know the timeline of events and their correlation with the systemic status, if any, and to get any insight into the atypical ROPs. So this is one of the example of premature babies of 31 weeks of gestational age with a birth weight of 1.2 kg, where at the day 4, we can see the retina is not fully mature. But as we go ahead, like in the day 11, there are few peripheral tortuosities has been started developing, which is becoming more prominent as we progresses, and there are few hyperacute branches also. So as we go further, there is formation of ridge also, and the formation of fully mature retinopathy of prematurity. And the similar findings which we also observed in the other eye as well. So coming to the results, so we included around 406 babies with a median birth weight of around 1400 grams and gestational age of median of around 32 weeks, of which 406 babies, of which 56 babies developed ROP. And we noticed that the timeline of appearance of vascular changes developed from 9 to 17 days when we compared to the premature babies who didn't develop any ROPs. So what are these vascular changes? So we found out like total 6 vascular changes, such as tortuosity of peripheral retinal vessels, pairing and crowding, that is adjacent vessel coming to closer, hyperacute branching, short AV shunts and long AV shunts, and short tortuous vascular loops. So of this, which is most commonly ignored, that is the peripheral vascular tortuosity, which found to be most statistically significant when compared between the babies who developed ROP and no ROP babies. Also, the other vascular findings were found, but they were not that statistically significant, but we could found, such as vascular loops, vascular crowding, AV shunts, and vascular pairing. So to conclude, there are many vascular changes that appear earlier than the current guidelines for the first evaluation of ROP, though they are subtle but detectable. It can be possibly used as a fundus biomarker and artificial intelligence tools in predicting any treatment warranting ROPs. So the retinal vascular changes that significantly linked with ROP development, with the strongest link with tortuosity of peripheral retinal vessels. The strength of our study is the serial evaluation of fundus from birth to the development of ROP, which is first of its own kind. It can also unravel many unnatural histories, timeline of events in ROPs, and mysteries of atypical and aerobes. Though there are few limitations, like we didn't include FFAs, larger sample size at different geographical locations, and we couldn't find the correlation of fundus biomarkers with NT and postnatal events and NICU care. Thank you.
Thank you. I think data is encouraging, but again, see, the biggest problem with ROP in our country is screening. So does this data of yours, or the way that you're looking at this, does that change the way that you could recommend some change in staging or screening, or, you know, so?
Maybe if we can install the RedCam or something, which like a fundus camera in every NICUs and all, that can be more helpful to babies, and even the tele concerned, like for fundus imagings.
But ultimately we already have a classification, we have a protocol to stage them and to follow them up. Yes. So do you think that with this study of yours, do you think that you would like to change something in the recommended guidelines?
Yeah, maybe as we saw that many vascular changes that they are subtle, but they can be detectable. So sometimes like small vascular changes which we miss while doing the first screening, If we can catch that, we can maybe treat better and more sooner.
Yeah, the problem is mainly here what is happening, the recovery of the baby in the that matters a lot during the NICU care.
Yeah.
So as you mentioned that the limitation, which becomes a main factor here. Baby can develop sepsis, the correction of anemia, multiple issues which compound. So that is why it becomes slightly tricky. Although it sounds promising, as you mentioned, at some places that AV loops, shunting, vessels, all those things, peripheral tortuosity, it's promising, but the problem is that's what, how the baby is treated. It's like many a times when we see babies might be admitted initially in a private setup or in a government setup because of some logistical, economical issues also. And the care which is given in the first few hours or in the later part of the development of the baby may be a confounding.
There are various factors
here.
like what care the baby gets, how the nourishment is.
I think also you talked about the peripheral plus disease, the peripheral tortuosity. I think the ROP3 also talks about the peripheral plus, but it does not say that if you look at if you do a fundus examination and you have this peripheral plus, then you immediately or you try to treat these babies or you have a very close follow-up, because you are following up these patients every weekly, which is very difficult to follow them up in a realistic world. We try to call them 2 weeks or 3 weeks if there's no central plus, because we know that there is peripheral ischemia, definitely there will be some peripheral plus, but if the plus disease is not present at the posterior pole, we usually do not recommend treating them or calling them every 1 weekly. So I think it would be good if you try to look at more data, you try to do a comparison whether the ones which developed a peripheral plus disease, did they progress to a very severe disease vis-a-vis a patient?
Depending on the severity of.
I think you need to look into your data even more extensively, and then you might come up with some very interesting conclusions.
Sure. Thank you.